Test 1 2 3. Test 1 2 3. Love it.
Everything looks good. Thank you.
Good.
You know me and my steps. I need a box. These people are. Listen, I just need Deborah Dill to show up because I'm her understudy. I have 4 bullet points in my book. That's all I have. I don't do good on stuff. I say things that I probably shouldn't say when I don't have it planned out. Who's this guy walking down the middle? I don't give a clue. Okay. No, I just don't do it. You know what we need? We need. See, these people can't even see me over there. See, I'm totally invisible.
Let me see if
Don't break it because I'm not buying it.
I'll just say some rando person came in and did it.
Who's breaking my
Yeah. Or
Yes.
like that at least. You did something. Is that better? You can get some sort of sideline with them?
Sure. It's better than nothing. Or I could get a box. I could request a box. Oh, that's all I need.
Those wheels that take off. I'd be known as the better killed by the seats.
Or at least paralyze me from the neck down.
If you need to adjust the mark, this is it.
Yeah, but
Yeah, you know that. Let me go and turn it back on.
because I'll be quiet.
Why is it turning on? It's flashing. Okay, if you need anything, I'll hold it, okay?
afternoon. Thank you for responding. I heard that from over there. My name is Chris Smith, and I'm the director of the School of Nursing at the University of Tennessee at Chattanooga, and I want to welcome you to the Fall 2021 Whitecoat ceremony for the UTC School of Nursing in person and live streamed. We are so pleased to see so many people. Now, I'm asking you to keep your masks on because I cannot be the source of a super spreader event on the campus. If the word gets out that we got positive people out of this, I think my job will be in jeopardy. So please keep your masks on. We appreciate that. The purpose of the Whitecoat ceremony today is to recognize the students' transition into one of our nursing programs. The undergraduate students will be entering the BSN program, while the graduate students will be joining other students in the MSN program as they study to become advanced practice nurses. This marks a major transition for these students as they begin to assume the responsibility of caring for patients at new levels. The ceremony is an opportunity for us to welcome these students into the School of Nursing by presenting them with the lab coat, the symbol of professionalism in nursing. I'd like to acknowledge a few people who were so supportive of our nursing program here at UTC. We want to thank Dr. Steve Angle, our chancellor, and Dr. Gerald Hale, our provost. They have been always very supportive of our program. But right now I would like to ask Dr. Valerie Rutledge, who is the dean of our college, which is the College of Health and Education and Professional Studies, to come forward and make brief remarks. Dr. Rutledge.
I think Dr. Smith said it best when she said one of the most exciting things about today is that you're here with us. When we've done this over the last few months, I'm sure you know it was mostly streamed with just the students who were here. So the fact that you're able to be here and celebrate with them is a significant thing. The other thing that I would say to you today, and to the students especially, thank you for choosing a profession that has proven to be one of the most important over the last year and a half. One that has protected people, that has served people, and that has made sure that we did everything we could for those who have been in need. And for those of us who appreciate everything you do, I hope you recognize that you're choosing a profession that will continue to be one of the most important ones. All of the research says if you look at professions, nursing is always ranked at the top or near the top for those that are most respected for what they contribute and what they do. So thank those of you who have made that choice. Thank you not just for making that choice, but for recognizing the effort that it takes to become the best nurse possible and to serve those who need you at various times in life. And for you who are parents and friends and others who have come to celebrate with them, thank you for your support, because without you it would be difficult for them to be able to do the things that they do. So congratulations on today. I know you look forward to it, and we are thrilled that you're here with us. Thank you.
Dr. Rutledge usually stays with us for the entire ceremony, but she is going to resume a Zoom meeting that she stepped out of to join us. So thank you, Dr. Rutledge. I'd like to acknowledge the nursing faculty here present, and I bet these students have never seen this many faculty in one place in the last couple of years. So faculty, the School of Nursing, are most important in providing you with an excellent education and preparing you to be able to go into the workforce practice ready. So nursing faculty, please stand and be recognized. These are the faculty who actually are instrumental in your educational journey, as well as instilling in you those professional qualities and those ethical standards. At this point, I'd like to ask Dr. Angel Collier, the School of Nursing Associate Director, to come forward and introduce our guest speaker. Dr. Collier.
Thank you, Dr. Smith. I just want to welcome all our new nursing students. I got to say hi to the undergraduates, so now I'm saying hi to the graduates. We're so glad you're with us. I know UTC's glad you're here. Chattanooga's glad you chose nursing or advanced practice. Actually, the whole country's glad you're going into nursing. I think they want you graduated almost as much as you do. So good luck and graduate well. All right, with that, it's my privilege to introduce our guest speaker today. It's Deborah Deal. She is the Chief Nursing Executive for Park Ridge Health System. In 2020, she actually won the Nurse Leader of Distinguished Award from the Tennessee Hospital Association. This honor recognized Ms. Deal for her work to optimize patient experiences, enhance nursing retention, as well as the quality of service provided across the Park Ridge system. She also is nurturing the career of countless number of nurses. She earned her undergraduate degree here at UTC, so she's been where you are. She got her master's in nursing administration, and she's currently working on her DNP here at UTC. So she's going to book in UTC, and now it's my honor to welcome Deborah Deal.
Thank you for inviting me to come today. And I graduated from UTC School of Nursing. It was just a couple of years ago. So I really remember where y'all are at. Now, actually, I've been a nurse for 32 years, and I realize that's longer than most of you in this room have been alive, but that's okay. I've come to realize now that they call us seasoned nurses at that stage in our career, but it's a privilege really for me to be here and be able to speak with you today. Anytime I can be in a room full of nursing students, I am very happy. And so as I kind of reflected back a little bit on, nursing school and decision to go to it, for me, I knew at the age of 6 that I wanted to be a nurse. And my grandmother was a nursing assistant at a local nursing home, and I was able to go and see her interacting with patients. And she said something to me one day that has really stayed in my memory bank all these years. And she said to me, "These are not patients, these are my family." And that's the way she treated them. And so I decided I wanted to be a nurse. And so the day that I found out that I was accepted into UTC School of Nursing, I still remember that. And that was a very proud day for me, because that was really a lifelong goal of mine, to be a nurse. And so as I think back about, nursing in general, and to me, I kind of think that nursing is a little bit of an intersection between knowledge and science and care and compassion. So I think to be a nurse, we really need people who are smart. Those of you who've already been in the program know nursing school's tough. It's hard. There's a lot of work. These folks over here make sure there's a lot of work, and that's good. They should. We need people who are competent, who are trained, who are highly educated and highly skilled. If you think about it, and people say it lightly sometimes, but it's true, nurses really do have people's lives and their health in their hands. And so the work is important, and it's stressful. I think I am so happy that I wasn't trying to go through nursing school during the middle of the pandemic. So I have a special place in my heart for all of you who are trying to learn and to go through clinicals and go through the classwork and everything else that you're doing in the middle of this. I know it's difficult, but I want you to know the profession that you've chosen is important, and it's already been said, and I'm proud to always see it and know it. I think it's 20 years running that nursing has been named as the most respected profession. And so that's in Gallup polls. And so if you think about all throughout the country, people are being asked, what's a profession that you would really respect and trust the most? And so for that to be nursing, I feel like that's an honor for us, but I think it's also something that we have to really make sure that we support that and that we do what we need to do as nurses to continue that. And I think nowadays with social media, it's an even more interesting time. And so I would just encourage you as up and coming and nursing professionals to really think about the things that we post and we say, because people really do take that to heart, and they feel like nurses are honest and that we are respected. And so I think we have to really make sure that we honor that. And so again, I'm proud of all of you to be at this point, and for your families. I know that it's a lot of sacrifice and a lot of work. Clinicals are long, There's a lot of work that goes, into that beforehand, but it's important. I would just encourage you as well to be proud of what you're doing. I think sometimes people go into nursing because they really do want to care for people, and we have that in our heart, and that is great, and I hope that is the reason why you chose it. We hear many times from people, well, I'll always have a job, and that's true, you will. You could have any job that you wanted right now, but I think nursing is more than that, and it really is a profession that I feel like you've got to really have that passion for patient care and for really being there to help take care of people. But be proud of where you're at and where you're going, and just know that there's a big support system out here in nursing. The other thing about it is there's a lot of us, there's a lot of nurses, and we need more all the time, but there's a support system with that. And I think it's important here, very soon, within a few years, many of you will be precepting new nurses. And I know right now you're thinking, there's no way that I could do that. You will, and you'll do a great job. And it's important that we continue that, and that we foster younger nurses that are coming along and make sure that you have the training and everything that you need. And so again, I say congratulations, and it's a great privilege just to be here, and an honor to be able to do this. And you've got a long, successful career ahead of you. And the profession of nursing, I just feel like there are so many opportunities, and there's so many things that you're able to do with that it's exciting. And again, thank you for choosing it, and for really being those patient advocates that we need. This has been, I'd say, in the 32 years that I've been a nurse, the past 16 months has obviously been the hardest. I've talked to a lot of new nurses that have said, I've never seen anything like this. And I said, well, I've been a nurse for 32 years and I've never seen it. And we hope that we don't ever see anything like this again. And just know that what you're seeing right now is not really the norm, and it will get better. We know that it will, and just hang in there with it. And thank you very much.
Thank you, Deborah. We really appreciate those words of wisdom. So at this time, we're now going to recognize the entering Bachelor of Science in Nursing students by presenting them with their lab coats that are embroidered with their name. Dr. Kelly Han, if you'll come up, she's our level 1 facilitator, and she's going to read the name. So students, y'all come on.
Shayo Anafooshe. Brooklyn Barker. Ayana Boyce. Hannah Canfield. Ashlyn Cobb. Mallory Collier. Clara Dolan. Grace Egan. Gracie Faulkner. Daisha Gascon. Avery Green. Leslie Grider. Eli Haynes. Maggie Howell. Jonathan Keck. Lily Colwick. Sarah Levine. Tinley Lithick. Brett Longmire. Megan Mackey. Rachel Martin. Caitlin Mathis. Daniel Morataya. Ali Paliero. Samuel Paris. Holly Petty. Alyssa Reno Dimmick. Fatma Sheikh. Rachel Skillman. Grace Smith. Mia Smith. Madison Smith. Amanda Tabor. Emily Wells. Beth Whaley. Emily Wilkie. Margaret Hooten.
Go ahead and congratulate our undergraduates.
You know, it's really nice to be back in person to hear the enthusiasm, because when we were Zooming, we didn't get to hear that too much unless you left your mic on by mistake. So glad to have everybody back. We're now going to recognize the entering Master of Science in Nursing students by presenting them with their lab coats. The interesting thing about this group is they are the last master's group. We are transitioning to the Doctor of Nursing practice for all of our advanced practice roles. So you guys are the end. I was the beginning, and you are the end in the master's program, so we're excited. So I'm going to ask first Dr. Amber Roche, who is the program coordinator for the nurse practitioner program, to come forward and read those students' names, and then Dr. Linda Hill, who is the program coordinator for the nurse anesthesia program, will come forward and read those students' names. Dr. Roche? There you go.
Ready? Okay. Johanna Cortez. Sarah Evett. Catherine Henderson. William Lane. Sharon Rowser. Rachel Sadler. Dr. Hill.
Well, they may be the last MSN cohort, but they are going to be great. All of them. Copeland Taylor Cobb. Stephen S. Scott. Megan Hartman. Taylor Hernandez. Alexia Ingram. Eric Jones. Laura Moreland. Allison Sawyer. Emily Spence. Hannah Vick. And Jonathan Reed Walden. Thank you.
This is exciting. We've got lots of new nurses on the forefront, and they're all, I know, both the MSN groups, the anesthesia group, and I'm getting to know the family and acute care nurse practitioners, because I've taught the nurse anesthesists in summer, and I'm teaching the new ones, the new MSN, FNP, and AGA, CNP now. So I look forward to knowing the BSN students. So hopefully I'll get to teach you sometime before you graduate or become an advanced practice nurse. Right now, I would like the students to all stand, and we're asking them to affirm their responsibilities to their patients, their faculty, and their fellow students. So it is on the back of your program, I believe. You'll turn it over, and you will answer in unison, "I will," to each of the following statements. As a nurse to providing the highest quality care and services, will you pledge to consider the welfare of humanity and relief of suffering your primary concerns? I will. Act in a compassionate and trustworthy manner in all aspects of your care. I will. Apply your knowledge, experience, and skills to the best of your ability to assure optimal outcomes for your patients. I will. Exercise sound professional judgment while abiding by legal and ethical requirements. Accept the lifelong obligation to improve your professional knowledge and competence. Promote, advocate for, and strive to protect the health, safety, and rights of the patient. With this pledge, do you accept the duties and responsibilities that embody the nursing profession? Now, I'll ask the students to recite in unison with me the International Council of Nurses Pledge found on the back of the program. Reciting this demonstrates your willingness to uphold the pledge and to fulfill it as you begin your journey through nursing school. Here we go. In the full knowledge of the obligation I am undertaking, I promise to care for the sick with all the understanding I possess, without regard to race, creed, color, politics, or social status, sparing no effort to conserve life, to alleviate suffering, and to promote health. I will respect at all time the dignity and religious beliefs of the patients under my care, holding in confidence all personal information entrusted to me and refraining from any action which might endanger life or health. I will endeavor to keep my professional knowledge and skill at the highest level and to give support and cooperation to all members of the healthcare team. I will do my utmost to honor the International Code of Ethics applied to nursing and to uphold the integrity of the nurse. Thank you, students. Having pledged this, and they pledge to care for vulnerable people they will encounter each day as they work toward providing compassionate and competent care, I want you all to please join me in congratulating them as they enter this exciting part of their journey. Congratulations. I must say, this is the first group in the history of the School of Nursing that got a standing ovation. And with that, I just want to say one more time, as Deborah Deal spoke to you, we are so thrilled to have you entering this profession. It's tough, but it is truly rewarding. Congratulations and enjoy your families. Thank you for coming. Not bad. Now what do I do with all of this?